Let's go over the AED real quick. So this is an automated external defibrillator. This is not the same thing that you see on the TV shows, on the hospital shows, where the doctor says, go ahead and give them a shock. The automated external defibrillator will look for two different types of arrhythmias, and if one of those are present, it will allow you to give a shock. If they're not present, it won't. It won't allow you to override it and give a shock. Survival dramatically improves with the use of an AED over CPR. So as long as it's used within the first few minutes of cardiac arrest. That's the reason an AED gets priority over CPR. Remember back to body systems and when we talked about CPR, how victims that are administered CPR, a third of those victims survive. 2/3 survive if an AED is used. So that's the reason it gets priority over CPR. Electrical activity in the heart. So we've got the vagus nerve that innervates the SA node. The SA node sends out electrical signals to the pacemaker cells within the atria. There's a slight pause, and then it sends that signal down to the AV node. The reason there's a pause is so that the atria and ventricles aren't contracting at the same time. The AV node, atrioventricular node, sends out electrical signals through the Purkinje fibers, which activates the pacemaker cells within the ventricles, and then the ventricles contract and pump out blood either to get oxygenated to the lungs or pump out oxygenated blood to the rest of the body. So those pacemaker cells are kind of like people in a stadium. So you've seen people do the wave through the stadium. I guess people still do that. As long as those people are getting oxygen, as long as those cells are getting oxygen, the wave is nice, uniform. You get this nice uniform contraction across the stadium with people. You get that nice uniform contraction through the heart. Well, if those pacemaker cells don't get enough oxygen, they misfire. So that's equivalent to people just standing up randomly. You don't get that nice wave, that nice contraction that goes across a stadium. Well, same thing happens in the heart. If those pacemaker cells don't get enough oxygen, they misfire. And that's where you get quivering, which would be ventricular fibrillation, or they just misfire so much that the heart speeds up, ventricular tachycardia, and it can't pump effectively. So your heart, on average, beats around 60 to 100 times per minute. So for a healthy individual, 60 to 80. For people that don't have good cardiovascular health, you may be up in the 100s at a resting heart rate. Ideally, we want our heart to contract about every second for a good, healthy heart. Some people are lower than that. People that do a lot of aerobics may have resting heart rates in the upper 40s. I've had that happen before to me, where I went into a doctor. They thought I had a condition known as bradycardia because I had a really low resting heart rate. What was happening is I was just teaching 3 to 4 aerobic classes a day. And so I was getting really fit, aerobically fit, so I had a really low resting heart rate. During the summer, when I lift heavy weight and try to get bigger, my resting heart rate actually comes up into the 60s, sometimes 70s. But when I do a lot of aerobics, it really drops down. My blood pressure also drops way down. All right, so this is the path of electrical activity in the heart. This is kind of above and beyond this class, but I wanted you to see the SA node is here. So the vagus nerve innervates it. It sends out these electrical signals to the atria. There's a little pause between here, and then the AV node fires. These are the Purkinje fibers that I was talking about that innervate the ventricles and cause them to contract or cause the pacemaker cells to contract. But if you look over here, if you've ever looked at a heartbeat on an EKG, you may have seen this wave, and I wanted you to understand it. So right here is where the SA node fires. So when you see that part, you should see a normal little wave here, and that's this part happening here. That's the reason it's color-coded. So this is the pacemaker cells firing. There's a little pause. So here's that AV node pause, so we don't get the ventricles contracting at the same time that the atria are squeezing. So this is the QRS complex. That's when the ventricles squeeze. And then this is when the ventricles relax, and it's all color-coded. So you're obviously not going to see this one over here because this is when the atria contract. We have a pause, then the ventricles contract, and then the heart fills back up with blood. And then it starts over again. Atria squeeze, send it out to get oxygenated, comes back to the heart, ventricle squeeze, pump it out to the rest of the body, or if it's right ventricle pumps out to the lungs, left ventricle pumps out to the rest of the body. That's how the heart works, and that's the electrical system working with the blood flow that we talked about in the last video or last lecture. That's how those two work together. So disease, atherosclerosis, hardening of the arteries. So if you smoke, may have a poor diet, all of those can lead to hardening of the arteries so they don't expand and contract like they should. And that can result in a heart attack, especially if a clot comes through. So you may have plaque that's built up, plaques rupture, clot forms, shuts down blood supply. If that happens in the coronary arteries, you have a heart attack. If that happens in the carotid arteries or any artery feeding the brain, that's a stroke or a brain attack. So lack of oxygen to the heart can cause the pacemaker cells to malfunction. That causes abnormal electrical activity in the heart. That's why I was talking about the pacemaker cells misfiring and the heart quivering. That's called ventricular fibrillation, and that is cardiac arrest. So you're not in asystole. The heart still has electrical activity at that point, but the heart just quivers. It doesn't pump. Or you go into ventricular tachycardia, where the heart just speeds up. It doesn't take full strokes, so not all the blood leaves the heart, so therefore not enough is pumped around. And it's an out-of-control mechanism where the heart continues to speed up and go faster and faster and faster and faster, and not enough blood is returning to the heart. And eventually that leads to ventricular fibrillation, where the heart just quivers. So what I was just talking about was ventricular tachycardia. Pumps too fast, can't pump effectively, leads to ventricular fibrillation. So VTAC, that's one of the arrhythmias an AED looks for. Ventricular fibrillation, another, the most common type of arrhythmia. Almost all arrhythmias will lead to some sort of ventricular fibrillation. So there's loss of organized electrical impulse, no pulse, because the heart's really, it's just quivering. It's not pumping blood out of it. And therefore there's no pressure to make a pulse. So watch this video and then answer the questions on your lecture notes. AEDs, so what do? They analyze. So they're looking for, and when I say analyze, they're looking for two different types of arrhythmias: ventricular tachycardia, ventricular fibrillation. If one of those is present, it'll say shock advised. And then you can give the shock. So here's how it would go down. Let me just show you. First thing you do with an AED, you turn it on. Once you turn it on, you wipe the victim down, put the pads on. The pads allow it to analyze. Once the pads start to analyze, it's going to tell you one of two things: shock advised or no shock advised. If it says no shock advised, begin CPR until it tells you it's analyzing again. If it says shock advised, you warn everybody again. So you warned when it was analyzing, you'll warn when you're going to give the shock, and you give a shock. And hopefully that shock corrects the rhythm and gets them back to a normal rhythm. But you can only shock if they have ventricular tachycardia, ventricular fibrillation. So that's how an AED would work. You also have what's called event memory. So with event memory, the AED is recording things like date, time, number of shocks given, because sometimes the first shock doesn't always bring them back around, and it may not be successful. And then the victim's heart rhythm. What type of arrhythmia were they in? Ventricular tachycardia, ventricular fibrillation, both. Did ventricular tachycardia lead to ventricular fibrillation? So it gives the people, the hospital staff, some information. And the reason I say that, the reason I even mentioned it, is because the EMTs may want to take your AED with them so they can download that information. You'll get it back. I know it's an expensive piece of equipment, but you'll get it back. But it allows them to see exactly how long the victim was in that condition. So common elements to all AEDs. You're going to have a power on and off switch. You're going to have cables and pads, adult pads and pediatric pads. So if they're a young child or an infant, use the pediatric pads. If they're an adult, past puberty, use the adult pads. It allows you to analyze, and if the appropriate arrhythmia is there, it'll allow you to shock. It'll give you prompts, and they're all portable. So common steps, just like I mentioned before, your very first step is to turn it on. I do have you remembering the major steps for this class, but if all you remember is to turn it on, all you got to do is do what it tells you to do. And the next thing it's going to tell you to do once you turn it on is to dry the area, because they may be all sweaty, especially if they had a heart attack. Shave them if they're a big burly guy. You're not doing a cosmetic job. Just shave the areas where the pads are going to go. You don't have to shave the entire chest, just where the pads are going to touch. Correct pad placement, upper right, lower left for an adult. If it's an infant or a small child and the pads are touching, go front and back. So one on the chest, one on their back, same placement on each side. They're all going to allow you to analyze for a heart rhythm. They're all going to allow you to shock if the appropriate arrhythmia is there. And they'll all remind you to do CPR. Some of them give you a pace to do CPR after you've given a shock or if no shock's advised. Special considerations: don't use an AED in water, like in a puddle of water. If you pull somebody out of a pool, wipe them down. Make sure they're not in standing water, because it can cause the AED to malfunction. You could also get shocked if you're in that water when you give a shock, and it can put somebody in a healthy rhythm into an abnormal rhythm. So children and infants, front and back for the pads if they're touching. If you can't do upper right, lower left with a child, do front and back. Medications. So if the person is taking medications, make sure you know what medications they're taking. Now, if they're unconscious and unresponsive, when I talk about medications, I'm really talking more about medical patches. So be careful with those, because they may have like a nitroglycerin patch, especially if they have a heart condition. Nitroglycerin is a patch because it's absorbed through the skin, and just like it can go through their skin, it can go through yours. It causes vasodilation, and it can cause you to get lightheaded and pass out if you experience it. And don't put the pads directly over implantable devices. So they may have a built-in pacemaker with an AED. Obviously their AED may not be working. So that's the reason we go upper right, lower left, is to avoid that pacemaker or implantable device. If they have nipple rings or necklace, wired bra, all that has to come off. Anything metal will interfere with its ability to analyze and give a shock. So they're going to have to be bare-chested. And you can have people take blankets or jackets and get near somebody that may be, I mean, they're unconscious, unresponsive, they're having a heart attack. I don't think they're going to be embarrassed about people seeing their exposed body. And you're just exposing the upper body. AED maintenance, pads expire, they have to be checked. Normally you'll have an OSHA administrator in your building or somebody in charge of that AED should be checking them, checking battery life, making sure razors and the hand towels are still in there. This is video 2. Watch the video and then answer the lecture question on your lecture questions.